Good afternoon, everyone. Okay. Our first death occurred today. This is a 79-year-old male from Clarendon with a travel history from New York. He is known to have diabetes and hypertension. He presented to the Lioneltown Hospital on the 16th of March with fever, cough, and shortness of breath. And that time, he was noted to be critically ill and was transferred to the Mandeville Public General Hospital, where he was isolated and treated. The patient had shown some improvement yesterday, March 17th, but today his condition started to deteriorate. His test came back positive today for COVID-19. He continued to deteriorate today, and during the process of transferring him to the University Hospital of the West Indies, before he was able to leave the Mandeville Public General Hospital, he demised at approximately 3 p.m. The family has been informed, and the public health team are currently on the ground, both at the home and at the hospital, to put in all the necessary efforts to make sure that we contain this possible source of infection.
So I will now invite the Permanent Secretary for the Ministry of Labour and Social Security to give an update on the social protection support that is being provided to the Bull Bay community. Also, we will take questions right after her presentation.
Afternoon, everyone. The Ministry of Labour and Social Security, we play a critical role in providing welfare support to those usually in the aftermath of a natural disaster, but this is a different kind. So far, as we speak now, there are teams on the ground delivering welfare packages to families, and to date, at the end of today, they would have distributed approximately 900 packages to families. The areas that were covered include St. Thomas Road, Parle Road, Morales Road, Main Road, Shooters Hill, the seaside along the main road there. We work with a joint team from the Ministry of Labour and Social Security and Red Cross. They have been very instrumental in assisting us with packaging of food items, and I want to use this opportunity to express publicly the government's appreciation to Food for the Poor, the private sector organization of Jamaica, Industrial Sales, Excelsior, Crackers, and a number of other companies who have come forward to donate items for the families. The families not only receive food, but they also receive hygiene packages, which include basic things such as toilet paper, soap, and a small bottle of bleach in some instances. We continue with the distribution as the need arises, but I want to also use this opportunity to say that the team we do have some challenge on the ground, because we do have a number of families who want, should I say, to abuse the system and want to get multiple packages of food. Let me just say no, that we do have enough, and the team will be going out tomorrow again to continue distribution for any families who didn't receive, and to also go back to the first set of families who received on Saturday. Thank you.
On March 15th, what symptoms are we seeing at that point, and when exactly was the person tested?
CMO.
Okay, so this case is now just being investigated. The person presented to hospital on the 16th, not on the 15th, okay? We got the sample yesterday, and so the testing started yesterday, and we're confirmed the positive this morning. In terms of all the symptoms and when the symptoms started, the public health team are on the ground and they're collecting that information. As soon as we get that information along with the contact history, start the contact tracing, we'll be able to provide more updated information.
You spoke about when the sample was received. When were the samples collected from the person?
I cannot say exactly when the sample was collected from the person. More than likely, the sample would have taken from the person presented. So from it became a suspected case, there's a travel history, a person is symptomatic, then they're classified as suspected and a sample would be taken. But the sample then would have to be received at the National Influenza Center for testing. So we know that the sample was received yesterday and the process of testing started yesterday and we got a confirmatory positive this morning.
Dwayne Anderson, TVJ. I'm sure many Jamaicans listening in would be panicking now that news has come of a first death. What would you say to them? And also, what are the statuses of the other 14 persons who are being treated?
Okay. So, as of this morning, for the 14 persons that are under treatment, now we have 13 persons that are stable and are doing well. 3 are totally asymptomatic now, and we will start their discharge testing shortly. We have 1 person that has been in our care for about, I think, 5 days, and that person has some chronic illnesses and is showing symptoms, some symptoms still. And there is a little, this morning when we spoke to the team on the ground, they said that the person was, not critically ill, but still ill. Right, so I just want to, just to refer to the chart that Dr. Webster Carr spoke about. The cases that we are seeing that are, for the case that has demised, did have several risk factors, okay? An elderly person with chronic illnesses. And again, we want to emphasize that these are our high-risk groups: chronic illnesses, elderly patient. I also want to emphasize that in terms of transmitting the disease, this is where the contact tracing is important, okay? So in terms of passing on the infection to persons, you realize that based on our contact tracing, we really have had very limited spread. Okay, and remember now that even in coming up for patient 1, where we have 5 persons that are positive, we have contacted hundreds of persons. Out of those hundreds of persons, a small subset of persons that have actually had reasonable contact, and only about 20 persons were symptomatic. And those persons have been isolated or quarantined and have been sampled, okay? And most of the tests are coming back as negative. We only have these 5 that have come back as positive, okay? So in terms of spread, we are not seeing that great spread. I think that the public has been sensitized in terms of staying at home. If you have symptoms, stay home, contact us, and we will guide you in what to do. And this is how we are going to be able to contain any of these centers of transmission that we have. Because as you notice, we have 3 other cases. Well, the case that has demised is new on the board, so we have not done all the contact tracing as yet. But for the other 3 cases, we have had the persons that we have contacted, very, very few symptomatic persons, and the persons that have been symptomatic have been tested negative. Okay? So it really is a matter of the public. The public has been acting. They have been realizing that persons who have symptoms are to stay at home. Okay? If you have had contact with someone who you think has been confirmed to have COVID-19, stay at home. I think that is the message. Stop the transmission, stay at home. Okay. Test.
So before we take the next question, I just want to make the point about the rationale for the quarantining of community and how effective the quarantining of community is, you'll notice that patient 1 from that community that we have quarantined was able to transmit to 5 other persons. Now, if we had not moved quickly to cordon off and prevent the community from moving outside of the geographical zone, these cases would not have been isolated, and we would not have been able to contain. Most of these positives that we found were from our quarantine facility when we moved the household persons from the household to quarantine facilities, and we were able to identify early when the onset of symptoms, and we moved them into isolation, tested them, and we were able to identify the positives from that process. So it's very important that the public understands why it is that quarantining is an effective tool for containment, and why it is that though there are hardships that will come from quarantining, the output of quarantining is so much more. And so if we really want to contain, we really have to maintain the robustness of what we are trying to do, as pointed out by the CMO. If you are unwell, stay home.
Okay, hello again, Brittany Clark, Nationwide News. Okay, I have a few questions. I'll ask them as we go along. So firstly, is the breakdown in terms of numbers of patients per parish available as yet? Secondly, when did the 79-year-old, the person who died, when did he return to the island, and has his information been released to the public in terms of for contact tracing purposes? And thirdly, have the medical officials been able to notice any trends in terms of the recovery of the patients, whether or not there is an observable or anticipated recovery time, and whether there is a fluctuation of condition, whether they fluctuate between stable and critical? Is that information available at this time?
Okay, so we can advise in terms of the contacts that are being followed across the different parishes. These contacts come out of the interviews that have been conducted around the communities that the confirmed cases are coming from. So while there may be several more persons that have been interviewed, we have narrowed down those persons to who are the true contacts, the persons that we are actually following up, all right? So in Clarendon, we have 21 persons that are now being followed. In Hanover, we have 3 persons, Kingston and St. Andrew, 224 persons, Manchester, 2 persons, Portland, 6 persons, St. Anne, 26 persons, St. Catherine, 9 persons, St. Elizabeth, 5 persons, St. James, 114 persons, St. Mary, 22 persons, Trelawney, 2 persons. A total of 434 persons that are presently being followed. Some persons may have dropped off this list because they were symptomatic and were tested and were negative, so they would have been pulled out. So these are persons that the parish health teams are following up on a regular basis to determine if they have any symptoms. In terms of symptomatic contacts that are identified, we have 32 symptomatic contacts that were identified. And as I said, these persons are followed closely. Some of them are in quarantine facilities, or I should say isolation facilities, and have been tested, and some of the results have already been available.